Okay, so we are really here right now. We are live with the Curling Community Conversations Thursday, 5 o'clock. And we have a special guest, Scottsdale resident, Dr. Kaveh Najafi. And I want to introduce him as, first of all, he's a friend of the show, friend of the family. And he is a graduate from a U of A. I won't hold that against him. He, he then did a residency in Brooklyn in Bed-Stuy. Then went to UC Irvine for a trauma fellowship, and now he serves as the assistant director for trauma surgery at a local Scottsdale hospital. And I want to say we're not going to name the hospital. We're not putting anybody's employer in the fire right here. We just want to talk to Dr. Kaveh and get a sense of where we are, because quite frankly, we're not getting the information that we need to with all the other events that's happening. So without further ado, let's welcome to the show, Dr. Najafi. How are you, Doc?
Hey, man. Thank you for having me. Doing great.
Oh, it's my pleasure. First of all, I sometimes have made the mistake, but can you kind of differentiate between a trauma doc and an ER doc?
Sure, 100%. ER physicians go through residency specifically for emergency medicine. Trauma physicians, although our patients come from the same place, are generally trained and boarded through 5 years of general surgery and then an extra 1 or 2 years in a fellowship for critical care and trauma. And so what happens is if you come in through the emergency room, both come from an emergency room, both come from ambulances and paramedics. But if you meet a specific set of criteria, you're generally upgraded. So any risk of significant injury that may require emergent surgery is usually upgraded to a trauma level. So that's kind of the difference. We work alongside our ER colleagues all the time. In fact, they come and help in the traumas and the activations. But the general consensus is they come from the same place, but if you need emergent surgery, then there's a trauma surgeon who's responding to you when you arrive.
Okay, very good. Excellent. Thank you. So with Dr. Najafi here, we do a community service trying to get knowledge to everybody. If you have a question, please just type it into the messages over there. Not the messages, I'm sorry. Put a question mark in front of it. Put it into the feed on Facebook. Campaign manager Andy Gomez will then get it over to us here in Zoom, and we'll try to answer it and get it back to you. Can you take me through like a typical day right now in the land of COVID through your work? From start to finish?
Sure. So if we work kind of all over the hospital. So we have patients that come in through the emergency room. We have patients who are on the floor. And then as surgical intensivists, we also take care of patients who are in the ICU. So our team is broken up into 2 separate teams, one that covers the ICU, and then one that covers kind of everything else and all the trauma activations, plus any of the emergent general surgery that comes in through the ER. So we're relatively busy. All of the patients that we see, whether they're admitted or they just come in, get a COVID screen, which is new now. And if they need to go to emergent surgery, then we just take those precautions. We wear the N95 masks to go directly into a particular room that's cleaned, and everybody in that room takes precautions. Anybody, that we're considering as a patient of possible, shows some COVID symptoms or is possibly exposed, those patients go to a particular floor and get the screening tests. And if you come back with not having tested positive, then you can be in our general population. We work really closely with our pulmonary critical care colleagues. And at this point, they're far busier taking care of the COVID patients on their census. And so we've kind of helped lessen that blow and kind of helping to take some of the surge patients. So they are taking care of the majority of the COVID positive patients that are currently in the ICU. And we're kind of that release valve, taking care of all the other patients, whether traumatic or not, but not necessarily COVID positive.
Okay, so I'm not really, I get what I get through the news.
Sure.
When I first started hearing about COVID, my first response was to try to help the community. And then it was, hey, knuckle down, get back to your home, stay solid inside your house. My feeling was that the governor did a pretty good job originally, kind of listening to the science and all, and not taking a political position. We then kind of turned and did a 180. So can you take me through this time period of how the hospital was, how many, I guess what they do is they say the number of ICU beds used and percentage,
Sure.
what kind of percent, talk to me about lockup, we're all hunkered down to now where we are. How's the trends going?
Sure. I think when we first started doing the stay at home and the distancing, it was really phenomenal. I think it was a great job. I agree with you because what it did was kind of prepare and give us time to kind of get the ICUs ready to kind of qualify and see kind of what our capabilities were, kind of how many ventilators we had, how many nursing staff, how many physicians were available. So it allowed us to kind of get ready for that. And so what that did was it slowed the progression of that virus and the disease. Fantastic. We knew that it wasn't going to eliminate the virus. We knew it was going to slow it down enough for us to prepare to take care of those folks, because in our ICUs on a normal day, on a normal, business day, we're taking care of quite a few different people, whether it's traumatic injuries, we take care of head injuries, really bad car accidents, gunshot wounds, stab wounds, all these things that require ICU monitoring. Plus, we also take care of those folks, my pulmonary colleagues who take care of all those heart failures and heart attacks and strokes and all those different things. Just because you have COVID, all of that doesn't go away. So we're trying to determine how do we set up to be able to take care of this new disease process, plus support a busy ICU that we're already taking care of. And so I think we did a real great job in Arizona by doing all that, and our numbers stayed significantly low. We kind of stayed ahead of the curve. We were able to get our PPEs and get everything in order just so that we could restart doing that. As far as reopening, one of the things that got shut down from our standpoint was elective surgeries. So everything that became emergent still had to be emergent. If you had to have surgery or die, then you still had surgery. But, elective cases were put on hold for a couple of months and just recently started to back open mid-May. And so one of the things that we did was was kind of the first time that all of the hospital systems in the area kind of decided to work together and say, listen, we'll share that COVID burden, but if we can start reopening surgery, because I think it's a hard subject. At what point do you say we're just going to keep hunkered down so we can keep this at bay, but then also know that there's the ramifications financially, and people do need to get back to work and do things. So where is that tipping point that you can try to balance them both? And so it's kind of really the first time that all the hospital systems got together and agreed to share that burden, and to allow us to try and work forward and go forward. And as we were expecting, once you open up, we expected that number to go back up and get higher, and that that rate to go higher. It's a little bit higher, I think, than we were expecting. But that being said, our particular institution has 5 sister hospitals. And of all the ICU beds that we have is a total of 168. Currently, right now, we're at about 60% full for the ICU. So at my particular hospital, I don't go to all 5. I stay at one particular hospital. My ICU beds, we're one of the larger hospitals that has the most ICU beds. So we have a total of 59 beds, and currently we're about 50% full. Quarter of that is COVID patients. The other half is typical ICU trauma patients that we see. So right now we're about 50% full. But as you can imagine, that particular number is still, the magic number is still 60, right? So if all of a sudden there was a dramatic increase and I got 10 more patients, that percentage drastically increases. So we're still trying to take our precautions and still, trying to stay ahead of the curve. But also, it's not necessarily just the bed availability, the actual room with the bed. It's also ventilators and then nursing staff to take care of them. Particularly really sick individuals have one-to-one care, one ICU nurse per patient. Whereas if you're not as sick, sometimes you may have a 3-to-1. The one ICU nurse may be taking care of 2 to 3 patients rather than just the one. So the demands on the healthcare requirements drastically changes.
Okay. I want to say thank you to you, the rest of the doctors, the nurses, the janitors, the people who are in the cafeteria, everybody who's on the front line. It takes a team effort And while I haven't needed the hospital, it's comforting to know that all of you are putting your life out there to make it
I
happen for all
appreciate
of us.
that. Absolutely.
Yeah. And for the audience, I would hope that we'd all kind of step back from emotion, right? Because you talked about it now, Dr. Najafi, and it's absolutely true. This is not a binary decision, whether we have to be completely shut down or completely open. But we do have competing interests in a sense, and each of those are valid.
Sure.
So we have to work with each other to make it happen. You and I have something else in common. We married way above our class, right?
True.
And you know that anytime you have the opportunity to say how much you love your wife, you should do it in front of people. So I'm going to say I love my wife tremendously. She's asked a question, so I will
Yes.
get to that first. And I want to apologize that I did not clean the bathroom as thoroughly as it should have been done, but I tried. Okay, so going along with our past conversation, we are now in full bore open mode.
Okay.
What is this, the mask debate? Can you clear it up for us? I mean, because I just thanked you for what you do, and I think
Yeah.
you need something from us as the general public.
So when we're in the hospital, at every single person that works in the hospital, whether you're, in the emergency room, whether you're in the cafeteria, whether you're part of housekeeping, everybody wears a mask. In particular, because it helps decrease the spread of the virus. So it won't necessarily, without the N95, the specialized masks that we're using, particularly for healthcare workers, it won't spread the virus from getting to you. It will spread you spreading that virus. So, new information's kind of come back out that's saying, yes, in fact, you can be asymptomatic and still spread that virus. So as a precaution in general, we're all wearing masks around the entire day. And so my idea about masks is that, if you're going to go out, and we're trying to kind of keep this thing at bay, we're kind of all in this together, right? And so wearing a mask when you're out in public is more of a sign of saying, I don't know if I have it or not, but I'll do my part to try and keep things at bay. I still want to go out and I still need to go grab things from the grocery store. I still need to go do things, to be a normal person, but I'll cover my mouth and, just kind of help contain that spread of the virus. So I think that's where the masks are. It's not to prevent you from getting anything. It's kind of doing your own part to help kind of keep things still at bay.
Yeah, and for me, I'll just say, even if you don't believe in a mask, wear a goddamn mask. And I'm sorry for saying those words, but here's the deal. When you sneeze, I say bless you.
Sure.
Doesn't mean I have to believe in God. Doesn't mean anything like that. It's a nice thing to do for a neighbor. It's a reaction. Sneeze, bless you, thank you, good, we're off, right? It's like
Sure.
a courtesy wave. Be nice to your neighbor. This isn't about you protecting yourself. It's about you saying to all the people around you, I respect you and your space. That's it for the mask for me. All right. Sorry. Speaking of masks, do you guys, as in the trauma surgeons, have all the necessary protective equipment?
I would say our institution has done a fantastic job of making sure that we have all the PPE. We are trying to be very conservative first, and keep them bagged up, and then washing them, and then using them and defragmenting them. We've actually been fine. So we do have enough PPE, which is fantastic. We know there are other places that are not as fortunate, but our particular hospital has done a fantastic job with that.
Fantastic. And then I imagine you get home after that and your wife hoses you down, right?
Yeah, so that's been kind of a chronic thing where I'm not allowed to wear the same thing home for a long time. In more particulars, I get, everything gets dropped at the door, and then I have to go shower and then come out. So, we're just trying to take all the precautions and minimizes everything that we could do. So my neighbors love
Exactly
it.
right. You have two beautiful kids and a wife, so wear a darn mask out there. Golly. Come on. My goodness. Put a nice smiley face on it or something.
Right.
Hey, oh my gosh. My wife's got another question. All right.
Sure.
Honey, I love you. She says she honestly thinks she's had the virus at the end of January. I thought I had a little something myself. And she'd love an antibody test. Are they available / reliable? And do you know if they're covered by insurance?
I don't know
Question,
about the
honey.
insurance part. I do know that, so our particular network, I should say, just kind of tested everybody. We were actually, for people who are doing hospital things all the time on the front lines, we were pretty low. We were, you know, just a couple percentage points. And so, I think that the idea of the antibody test is we don't know 100%. It could say that, yes, I've had it and now I am immune to it, or now that I have antibodies to it. And it could not. I think it's hard to tell 100% yet. We're trying to get all these tests out so we can test things. And anytime that happens, there is some leeway of what's accurate, what's not accurate. So I myself have had the antibody test and it was negative. So it is hard to tell, if you've had it, if you've not had it. Even if you go and get an antibody test, which I assume now are available commercially at doctors' offices, that even if it comes back negative, it's not 100% yet, but it's probably pretty reliable. So yeah, I still would say to that point, even if you get an antibody test and say it shows you had it and now that you're immune, I would still recommend kind of doing those same precautions, still wearing the mask, kind of still limiting your things out. Doesn't mean that, look at, I got a free pass, I can go out and hang out at the bars and do whatever I want because I'm immune. So, because what we don't know is, what do those antibodies mean? Does it mean that you totally won't ever get it again? Or does it mean that you are now,
As we like to say on the program, don't go out there licking doorknobs.
Exactly.
All right. Hey, we're talking here with Dr. Najafi. He works at a major hospital. We're not naming that hospital because he's been nice enough to come to us to talk about the inside look. If you have questions, please go ahead and fire them up right there in the comments section. We'll get them over to Zoom and try to get them answered for you. So my wife's maiden name is Baker, so I'm going to go to Alex Baker. He says, Doctor, how dependent is your hospital's COVID response on strong mitigation actions from the state government?
Yeah, that's probably a question out of my pay grade. We have quite a few people on the administration who are taking care of that, and that's a great question. But that's something that right now we're really just interested in taking care of folks and people who are injured, and so that I'm sure that's been a discussion, just not with me.
Right. I do like the way that you're discussing things with your other area hospitals, which some would say is my competition, but really it's about the Hippocratic Oath, right? Do no
Sure,
harm.
100%. Yeah, we're lucky enough to have 5 sister hospitals, and some of the other networks in town also have quite a few hospitals, and so it's really kind of a way for us, when it's still a competing business, the business at hand is still people. So there's hopefully a greater good that comes from trying to get things figured out and take care of folks above.
And there's a lesson for us all in there for sure, right? Work together. All right. Hey, Justin Flory has one here. It says, what time, you know this guy?
Yeah.
Not a good response there. Should I not ask the question?
Oh, no, Justin's a great friend of mine. Good guy.
Yeah, I know. All right. It says, what type of testing capabilities do you have in your facility, and what is the criteria used to decide who can be tested?
Sure. Great question. When you come to the hospital, everybody gets screened. If you're being admitted, you get a screening test. We do have a few of the rapid tests, meaning the turnaround time is about an hour. So now we have the ones that we use specifically take about 2 days. However, there's a couple labs out there that can be from the primary cares that you can go and do it. I will warn you, it is incredibly uncomfortable to get a nasal swab. It looks like it's about 1 foot long and it gets hubbed all the way to your nostril. And so it's not in particular that pleasant, but they're far more available, in particular at, primary cares and urgent cares. But if you do come to the hospital for whatever reason, you will get a screen.
Did they let you keep the nasal swab as a souvenir?
I have not done the swab. I have luckily have escaped any of the symptoms the entire time we've been doing it. And then did the antibody test. But a few of our team members have had the swab and did not appreciate it.
Wow. Okay. Yeah, I bet they didn't. Hey, so there are a lot of businesses claiming they're taking care of the hospitals and the workers and everything. Who's really divvying up the good grub there? Who do you want to give a shout out to?
I think one of my favorite places, even before everything happened, was Melee's. They have been amazing and awesome and helping feed all of the tireless people in the ICU and the nurses taking care of us over there. It's been a whole community effort. I can't say that, there's been a ton of people helping out and a ton of places dropping off food, especially in downtown Scottsdale and from everywhere else. And it's just been an amazing thing to be a part of. To keep going and doing stuff that you're expected to do, and then kind of see this huge support system from the community. So it's been an amazing opportunity, and kind of just to kind of see people come together and take care of everybody.
Yeah, that's fantastic. I think, what would be your go-to Thai dish?
Oh man, I kind of dig spicy. I like the Penang
Nice.
curry is my kind of favorite. Um,
Yes,
yeah,
yes, that stuff you can drink that like out of a straw.
yeah, but I feel like I don't always get the spiciest. I'm like, yeah, give it to me. I'll take it spicy. And I think they're like, yeah, sure, you're right. And so they still kind of dumb it down for me. But I dig it. I like the curry.
Yeah, the Penang curry, man. I've been making a little curry myself at home. I've been actually going with the spicy basil beef.
There you go.
Yeah, and I'll say a 2 on a scale of 5, and that thing will give me some. But I like it. I like it. I like it like that. Drunken noodles, good one too.
That's pretty
Okay, we
good.
got some questions coming in a little bit past COVID. Are you ready to move on to another subject?
Whatever you need.
Okay. One last question though, for people to get information. So you get the hospital information, you get the inside dope. Where do we get the 411? Where do we go for actual information that we can trust?
I still think, medicine is all specialized, and so you rely on those folks that's what their job is, right? Um, if there are certain, if there are certain people who are set up to take care of these kind of things, looked into these things, like the CDC, that's who I trust. There's also a website for the Arizona Department of Health. I think it's azdhs.gov. Fantastic, has all kinds of frequently asked questions and things to look up. There's also another one where I wrote it down. COVID-19.healthdata.gov. And that will show you the trends and kind of the numbers. It's kind of a number crunching area. I think anything that's reliable, that's CDC approved or .gov approved, are folks who are honestly working to try and get that correct information out. I know there's been several internet things and people, setting up shop and saying, this is what I think, here's what I do. And the way that we practice medicine to be is it has to go through lots of scrutiny, and you set up a test and then you see if that's reproducible, and you see if somebody else can do the same thing. And we rely a lot on statistics, and there's a lot that goes into publishing a study. And so just setting up shop, and putting it on YouTube, I would be wary of kind of hearing everything that is put on the internet or just kind of comes out. And so I think anything that's credible needs a lot of studying, needs a lot of support. And not to say that the CDC and the government can be wrong. This is kind of a new disease that we're trying to figure out and get ahead of, and we're trying to get stuff, get information out, and sometimes we're wrong. But we're at the most, you're trying to be credible, and I think that's where I would go for all my information.
Yeah. Now you and I think she calls herself the sexy Spitfire. Is that what she put? You and Shay, you're really passionate about reducing gun violence.
Yes.
Does Scottsdale really have a problem with gun violence, or do you fight, or is that fight in other communities?
No, it's 100% prevalent in all communities across the country and even in Scottsdale. So I think when people think gun violence, they think of gang violence. And I would warn that that's not true. We see we talked earlier about blunt trauma and penetrating trauma is just that, whether it's with a gun or a knife or a blade, something like that. And so our penetrating trauma numbers in Scottsdale, Arizona are not as high as some other places around the country that are famous for that, say like a Baltimore or Miami. But it's still higher than normal, right? It's still higher than kind of the national average. And so what we see, and the reason we see that is because we have a huge catchment area. So we take folks all the way up north of Payson. We take care of all the folks on the native reservations. Downtown Scottsdale, we kind of have a really large catchment area. And so gun violence is very prevalent. And it's not just gang violence. So it can be homicides, it can be suicides. It can be, families with guns with kids who find it and kind of decide to show their friends. And so the unfortunate part is that, yes, gun violence is prevalent even in Scottsdale, Arizona. And so our big thing is not necessarily gun rights. I don't have an issue. That's not where I tend to land. I don't have an issue with, you know, gun rights in and of itself, the Constitution and whatnot. Our focus is really more about gun safety and reducing gun violence and kind of common sense gun ownership. I'm not saying you can't have it, but if you do have it, you should be able to take care of it. And kind of, I would, make it akin to having a driver's license, right? You have to be a certain age. You have to practice at it. You have to get insurance for it. You have to do it every day. You have to prove to somebody that you can do it. And if you screw it up, it gets taken away. And so why do we have that for, particular things, but like cars and driver's license, but not for guns? And so I'm not against anybody having guns. My family grew up with it. My uncles and grandparents hunted. I particularly myself don't have guns, but I just think that there's a way to have them and a way to be conscious about having them and a way to be responsible about having them. And so that's kind of our whole outreach.
You are kind of dreamy when you talk like that. I can see what you're going for. I got to tell you, I am right there with you. I'm recognized as a gun sense candidate for Moms Demand Action.
100%.
I think there's an opportunity for some adult conversations by us ignoring them and just saying, oh, you're against guns or you're for guns, and we have this big divide. Again, there's this big squishy spot in the middle. We should have background checks for everybody that buys a weapon. We should be able to institute a waiting period so domestic violence doesn't, so women are not getting killed at such the rate they are. Perhaps men would stop and think a little bit.
Sure.
And just quite frankly, maybe at the federal level, allowing the CDC to study gun violence to find out if we really do have something here that we have to look at.
I work in a unique situation where we have a military partnership at the hospital that I work at, which means we train military personnel on trauma tactics and trauma care before they're deployed to real war zone areas and how to take care of that injured patient in the battlefield. And so obviously we're around a lot of folks who handle guns all the time. And so we actually, since we're a level 1 trauma center, we participate with our police officers all the time. And the SWAT team is it's not abnormal to see a whole SWAT team in the emergency room. And so we have these conversations on a daily basis, and the violence is there, whether it's intentional or not, and I just feel like if you are responsible enough to own a gun, then you're responsible to kind of go through those regulations to maintain your ownership. And so, and I've had these conversations with police officers, with SWAT team members, with military personnel. And it can get a little heated. You can imagine that folks in the military and armed forces and on the front lines and the police force really like having guns. But there's always a way to come back and kind of have that civil conversation about what's expected. And, if you are not stable enough to, be in and out of treatment for psychological impairments, then maybe you having a gun isn't the smartest thing. If you like to beat up, family members, women and children, maybe having a gun isn't the best interest for you to have one. So I think there's responsible gun ownership, and I think we can get there. I think just continuing to make it a topic and letting them know that I'm not trying to take away your right. I just think if you have it, you should be responsible. That's it.
Same. And if anybody out there who's listening wants to actually make a difference, take a look at Moms Demand Action. They have this SMART plan. It's an acronym for safe storage of firearms that they go through the school district, and it's just an informational thing. So it goes out to families trying to get them to say, I will lock up my weapons around children, and I will ask if somebody has, just common sense steps, because one dead child is one too many.
Yeah.
Hey, my friend Bryn is asking a non-COVID question. What's the leading cause of injuries in children in auto accidents? Not properly restrained in the booster car seats, sitting in the front seat when they're too young, and not tall enough? What's the number one?
Yes.
All of them?
All of it. So anytime, all of that safety equipment has been well tested over and over and over again, right? So I would definitely implore you to use the safety belt and the ages and the heights for booster seats and safety seats and all of that correctly, because the answer is yes. If you use any of that incorrectly, is what can injure a child. And so 100% misuse of any of that stuff is the answer. Particular injury pattern, is hard to say. But yes, if you're not using those safety belts or those booster seats, or, if those seats should be rear facing, not front facing, don't put the kids in the front seat, all those things. It's not the days when we grew up, you can't be in the back of a pickup truck or rolling around in a van. We've studied that. That's so yes.
Smoking cigarettes at age 10.
The little smoking mirror that's, the little triangle on the side while the kids are in the back is frowned upon.
Baby on board. Hey, I think it's still true, but perhaps Brad, who's watching and listening right now, I think if new parents want to kind of go down to the fire department and check their seat to see if it's actually hooked up correctly, it's not as easy as it looks. You have to put your knee in that sucker and get it down and pull the belt so it is all the way pulled and it goes when it goes back. Am I right?
Yeah, I did it, right? So I was a brand new parent, and we rolled out of the hospital, and I was still waiting for somebody to run out and tell me I wasn't allowed to take this thing home with me, but they didn't. So it's a big thing. So it's, you can go there and they can show you how the seatbelt works, what the safety straps are. All the fire departments can do it. There's also on the DMV websites, or, on multiple websites, and highway safety websites will show you how to do it and where to take it, and kind of what the recommendations are for child seats in front to back, how much they weigh, what size they are, and booster seats, and who can be in the front, who can't.
Yeah, parenting doesn't come with a manual. And as a teacher, I always say, and I really believe it, there are no dumb questions, only those that you don't ask. So Please ask the question, especially when you have kids. I'm going to answer Bryn DeFusco's next question, because this isn't really, look, Bryn, they put them in the front seat and they don't follow the rules because they're not being a parent to their kids. Be a parent first, be a friend second. If they complain, so be it. They don't have to like you. They have to love you. All right.
I would also, just to echo, all my kids wear at all times helmets for everything. So a bike, skateboard, scooter, all that stuff. So just as important as, you think I'm in a car, they should be totally protected. Same thing, we're on the bike, so please make sure your kids are wearing helmets. If it's a scooter, a skateboard, a bike, anything with wheels. My kids wear a helmet, we're just walking down the street. So to echo that point, yes. It's cool. You can get pictures of Tony Hawk on the internet with a helmet on. So he's a cool dude with a helmet. So
yeah, protective covering, mask when you're out for COVID, helmets when you're out on the bike path. Come on. That concrete and skull, it's your watermelon doesn't stand a chance. Are you all right answering a few more questions?
100%.
Okay, because these people love you out there.
Cool.
First of all, there's a lady named Cassandra who spells her name wrong. She spells it with a K.
Yeah.
And she says, is it true that you would never have made it through med school if it weren't for your sister? I think she needs a spelling test.
That is 100% true. I would definitely not have been here today without all of support and love of my family. So 100%, I appreciate that.
That's funny. That's good. Oh, boy. All right, your guy Justin's back. He says it's a little off topic. Now we're getting serious again all of a sudden. Okay, he says, what kind of things do you think can be done to address the racial inequities in medicine and healthcare? For example, developing and hiring minority doctors and administrators. And he ends with, you're a great interview, Kaveh.
I appreciate that, Justin. Man, that is such a big question, especially now of times, right? We see that racial inequality in so much of everything that is our daily lives. And medicine is definitely not immune to that. I don't know what the right answer is. I'm in full support of all the protests that are happening now, and the movement now, and the recognition that's been avoided for so long. But yeah, if I had the answer of how to make everything better, I would definitely not be still going to work today. So I would welcome. I think the biggest thing is continue as a community to kind of reach out and keep talking with each other, voting and making known that that's an important thing to you. And letting our leaders know, like yourself, that we're not okay with, discrimination, and we want things to change. So that's how I would do it. I wish there was a magic button to push and make everything right again, but unfortunately, I think it's going to take this continued passion and realization to continue.
Well, there's been this racial injustice for so many years. It's going to take years to unwind it, but we have to start now. We're not ever going to get there, right?
Sure,
I
100%.
think it starts with education. It starts with our kids. They don't grow up racist. They don't grow up they're not born that way. They grow into it, and we have to take a hard look at each other and ourselves.
Yeah.
All right, that was a big topic. Let's get to some fun questions, okay?
Sure.
All right. First of all, I do want to say that you and your wife do a lot in the community. You were nice enough to be part of that experience out in Mesa that I was able to attend for the foster children. It was really eye-opening. Thank you for that. And all you do for the community, it's wonderful. Thank you.
Yeah, that's 100% Shay. I'm not that nice. That's all of her. She just makes me show up to things, and so that's why I look good, is because of her. It's not actually me.
Well, she does wonders for you because you're looking good, my friend. You're looking good. Okay, I try to do a little fun show where we ask questions. A lot of times the viewers on the internet there play along because they like to. They don't have a life like you and I. So let's invite them to play Doctor. Give us the news. I'm going to ask you some questions about famous doctors. Now, famous for me is like just pop culture. Okay. So, I'm just going to, I'll go with an easy one now. Name this famous doctor, was an author, children's book, said, "Oh, the places you shall go."
Oh, there you go. That's Dr. Seuss.
Thank you very much. Okay. How about that doctor that talks to animals?
Doolittle. My kids love that movie.
Somebody's putting, all right, I'll go I'm going to go rogue here and come up with a question. Who is that heartthrob of about 75 years old, that doctor that President Trump won't allow into the briefings anymore because he's too honest?
Phil.
No.
Dr. Phil.
No. Think about the briefings that the president would have, and this stoic old man, he's a stud.
Fauci.
Yes,
yeah.
Dr. Fauci. A lot of love for Dr. Fauci. Bring back Fauci. Find Fauci. We need Fauci on this. All right, I'm going to sing a little ditty for you. I want you to come up with the doctor who does it.
Okay.
Could have been the right time. Could have been the wrong place. You know that one?
I would say Dr. Feelgood.
No, very close.
No.
Here's another one by him. Such a night. Such a night. He's from New Orleans, plays the piano. Just died about 2 years ago. His name's Dr. John.
You got me on that one, man.
We got a lot of people that said Dr. John. Okay. Again, I got to go rogue. Hip hop, mega mogul. The guy did a lot of Slim Shady stuff.
Yeah, Dr. Dre. It's fantastic.
Dr. Dre. D-R-E. Very nice. Okay. So you actually worked with medical doctors when they come in and they train your trauma. I actually worked with them when I was growing up by watching MASH. What was the name of Alan Alda's character on MASH?
Oh, man. I used to watch that all the time.
Funny show.
Golly, man.
Anybody out there know? Alan Alda, MASH. Used to have it for Hot Lips Houlihan.
Yeah. There's Radio.
Radar.
Radar. Sorry. Radar. Man.
I'm gonna have to call time on this one. It's Dr. Hawkeye Pierce.
Hawkeye. That's it. Yep.
Okay, yeah. I'm gonna stay in the comedy. All right? And this time I'm gonna give you the doctor. I'm gonna give you the guy who plays him. And I want you to try to give me the title of the series. This is one of my all-time favorite comedy series. If you're out there, try to stream it if you got nothing to do. Okay, Dr. Dorian was played by Zach Braff. Do you remember?
Yeah, so I would say that Scrubs was probably the most similar to what it really is like in residency is Scrubs.
Really, I love
Yeah,
that show.
100%. The ER is way off because nobody's that good looking and we don't get to sleep with each other all day. We actually have to do things. And
You don't
Grey's
get to play
Anatomy,
doctor?
same thing. Nobody looks that good, and
Wait,
nobody gets to
wait a
do all that
second.
kind of stuff. Scrubs is 100% what it's like.
You didn't become a doctor because in that residency you got to play doctor? There was
No,
none of
no, I couldn't get into anything else.
that? Okay, how about, all right, this is a really tough one. I don't know. I think you're too young for this, but this guy was the doctor on the Starship Enterprise. I'm looking for the nickname. His name was Leonard McCoy.
Yeah, Spock, Dr. Spock.
Okay, I'm going to give you that one. I was going to
Okay.
go with Bones. I'm going to go with
Okay,
Bones, but
gotcha.
Dr. Spock is right. He was a doctor. Okay, this guy turns into the Hulk.
Oh, Bruce Bannon.
Yes, we'll
Yeah.
give it to you. Dr. Banner. Very nice.
Yeah.
Okay, I already sang my song. I'm not going to sing it again. Okay, last one. This guy, I can't believe this. He went to Princeton, graduated, became a doctor at age 14 on ABC series.
Oh yeah, and then he grew up to be Barney, the womanizer, on my other favorite show.
Oh, yes,
How I Met
yes.
Your Mother. Yeah.
Yes,
He's fantastic.
yes.
Yeah. Dr. Doogie Howser.
Lovely.
Fantastic.
Fantastic. Hey, I do want to thank Dr. Najafi for being here. He came in, did us a service. He does a service throughout the community. Thank you, all the other doctors, the nurses, the frontline workers. Really appreciate it. People, take what he said to heart. Go out there and vote. Wear a mask. I mean, let's just change this whole thing. 2020 is our year. Go to curlin23.com. Get involved. Thank you very much, Doctor.
Eric, thank you, man. I really appreciate everything you're doing as well, and reaching out to everybody and kind of bringing us all together. I truly
Yeah, it was fun time. Fun time. All right. See you now, okay?
Thanks, buddy.